Good afternoon. I'm Dan DeRose with 19 News, coming to you from our digital center. We want to talk, unfortunately, about the flu. It has been running rampant, sort of a second peak of the flu season for the state of Ohio. For the third week in a row, Ohio comes in at very high, and it's actually, there's in the very high category, there's 3 designations. We are at the highest of those 3 designations according to the CDC. And when we start looking at the charts put out by the Ohio Department of Health, I want you to notice on the far right side, that gray line is, well, what our 5-year average, what we normally average. This year is nowhere near average. And the number that's really concerning, if you look at the bottom, we're talking about hospitalizations, the number of people who have had to be admitted with flu symptoms, and they're just not able to battle it as well, and so they're being admitted. In the last week of reporting, which would have been February 15th, we had a 25, almost a 26% increase in the number of people who had to check into the hospital. That is a major spike when we talk about what we're used to seeing in Northeast Ohio and Ohio in general when it comes to the flu. So who knows better than what we're dealing with than the doctors themselves that are on the front line, like Dr. Claudia Hoyen. She is with the University Hospitals. We've spoken with her in the past. Dr. Hoyen, thanks for joining us again today. How are you?
I'm doing well. Thank you.
Yeah, wish we had happier things to talk about here. I guess let's just ask the most obvious question is, what in the heck is going on?
It's not unusual for flu to have different types of seasons. You know, some seasons are quieter, some are busier, and this is clearly one of the busiest seasons we've had over the past decade. You know, back in 2009, we had a flu pandemic with the H1N1, and that was a very busy time. We were also very busy in, 2017. In 2019, we had a lot of flu deaths, especially in children. There were over 200. So things really change each year. We always look to the Southern Hemisphere to kind of see what is coming our way, since they're about 6 months ahead of us. And they did have a pretty significant flu season, as well as, we follow what they do. And so we, as you said, are not only seeing lots of people on the outpatient side with the flu, but as you said, we're really seeing a lot of inpatients. So far, I think they've estimated around the country greater than 300,000 admissions. And that was from, from a couple of weeks ago. About 13,000 deaths in adults, and in kids we're up to 86. So it's, we're worried for people, and, we want people to get tested, especially if they're high risk. Call your doctor, make sure, if you're eligible to take Tamiflu, that you do that. And also, it's not too late, Dan, to get the flu vaccine. Right now we're in the middle of a flu A surge. But we know that in the following weeks, flu B will also have a bump up. And so again, like I said, it's not too late. Especially if you've had the flu once this season, you don't want to get flu B on top of flu A. So there's always that as well.
That makes for a rough year. Let's talk about the people who end up having to be hospitalized. Is there something different about the flu this time around? It's to where you can't just ride it out on your couch. What takes it from, well, we better admit you into the hospital?
Yeah, there's different reasons why people get admitted for the flu. One is for the flu itself. So, you have the acute infection, you've got the fevers, you're starting with, typically a viral pneumonia. And so, those are some people that need to be admitted. The other thing is once you have the flu, you have lung damage, you have other things going on, and really what you have at that point is concern for a bacterial infection on top of the flu. And I can tell you at Rainbow, we've seen kids come in with both, whether they get admitted just with the flu or if it's with a bacterial complication to the flu. And we've had some kids who've been very sick. When you think about people who are going to end up in the hospital who've had the flu, usually, in kids at least, and I think it's about the same in adults, about 60 to 70% of those people have some sort of underlying condition. So maybe if it's an adult, they have congestive heart failure. Maybe if it's a child, they have asthma. But that leaves about 30 or 40% who are otherwise, healthy children and adults who end up in the hospital with the flu. So again, we know that getting vaccinated for the flu doesn't necessarily stop you from getting the flu. You can still get the flu, but it absolutely decreases your chances of ending up in the hospital with the flu. So again, like I said, not too late to still get the vaccine for those who are interested. Talk to your doctor, see what they have to say. And then remember, if you're sick, get tested, stay home. If there's medicines that your doctor thinks you should be taking for the flu, please do, because again, what we're trying to prevent are those complications of people needing to be in the hospital for the flu or for some sort of bacterial infection afterwards, which is usually a pneumonia.
We are speaking with Dr. Claudia Hoyen with University Hospitals, Rainbow Babies and Children's Hospital. An excellent doctor there in helping with this. The one thing, I think I covered this a month ago, and that's how long we've been dealing with this kind of nasty year, is the idea that there's a four-headed dragon out there, and we're dealing with the flu, RSV, walking pneumonia, and norovirus. I learned a new term, chaining. You feel bad for the kids who get one, then the other, then the other. What are parents supposed to do? I'm assuming there are some parents about to pull their hair out at this point.
Yeah, it has really been a long fall. All of this with the mycoplasma and the walking pneumonia started in the fall, and we've just had one thing after another. Fortunately, looking at the numbers over the last few weeks, RSV is really on the downtrend, which is great. We've certainly been seeing less kids who are presenting with what sounds like mycoplasma pneumonia. As we get further out from the holidays, hopefully all of the norovirus will quiet down, which it usually does, since norovirus likes people together, eating in very contained spaces. So that's usually how that will spread. So we're getting a little reprieve on that. The one thing that we have started to notice is that COVID may be going up a little bit again. So we'll keep track of those numbers. And again, that's why it's important if you're sick, if you can see your doctor or, get a flu/COVID test so that you know what you have. The medicines for to treat for the flu and for COVID are different. And so it's important to know if you have one of the other, if you're someone who's at risk. Again, talk to your doctor, be sure that if they've recommended medicines that you go ahead and take them to really try to keep yourself out of the hospital.
Yeah, that's some good advice. Dr. Claudia Hoyen with University Hospitals, we certainly appreciate the time.
Thanks.
All right, take care. That's going to wrap it up. Again, you heard the advice from the Dr. Hoyen that it's not too late to get the flu vaccine. I think the other takeaway is if you're sick, A, stay away from people, but B, get tested. Find out exactly what you have so that you might be able to start taking some of those medicines. We know that you need to take them within a pretty small window of first symptoms, and so that can also be a benefit. If we have any other breaking news, it'll be right here on our digital platforms. Otherwise, look for 3.5 hours of news and First Alert weather to start at 3 o'clock on Channel 19. Until then, I'm Dan DeRosa with 19 News. Have a good afternoon.